about the fact that he was excluding the single-payer advocates. There was a protest scheduled, and he threw the single-payer advocates a bone by having Congressman Conyers there and someone from PNHP there, and the protest was called off. We will not call off the protests. We will continue to engage in creative civil disobedience until this is delivered, sooner rather than later.
And if the hearings are closed, Russell?
Well, they're going to close the hearings to mark up the legislation. But it's not just going to be in Congress. We're going to be doing this all over the country. We're going to be doing it in congressional districts, and we are doing it in congressional districts. The regular means of communications have been shut down. Congress is not listening. Congress is only listening now to the big industries, to the pharmaceutical and healthcare industries. And so we have no choice now. When we stood up, and this is going to take doctors and nurses, and that's why this is a winnable issue now, because doctors and nurses are so frustrated that they're starting to see that this is the only way to do it. One of the doctors that we were arrested with last week, Dr. Carol Paris, is a psychiatrist in Maryland, and while we were sitting there in jail, she was telling me that one of her specialties is disturbed doctors. These are doctors who are so frustrated with the system that they're taking it out on their patients. So she sees a way to relieve the pressure on doctors as single payer so that doctors can once again focus on their patients. Right now, they're being distracted by insurance. I have a doctor friend in Maryland right now who's setting up his own business, and it's a total nightmare. He's got to deal with all these insurance companies and the bills and setting up the system. No time to focus on the patients.
Dr. Margaret Flowers, the #1 issue that is often raised in the media is people like choice, and people who have health care plans that they like, they want to keep them and be guaranteed of that. What do you think of the public plan next to keeping private plans, something that it sounds like President Obama is supporting?
Right. Well, I agree that Americans want choice, but I think Congress is confused about what kind of choice Americans want. What they really want is a choice of health care provider, the choice of where they can go to seek their health care, and the choice of their treatment. Because health insurance doesn't provide health care. It doesn't cover health care. The time when you're the sickest is when you run into the difficulties in trying to work with the health insurance. And the problem with the public-private option and the public plan that there's offering is that it keeps so many of the problems that we currently have. It keeps this next to the public option, yes, but you still have all of these thousands or over 1,500 private insurances that you still have to deal with. And so in terms of savings, we're not going to see the savings that we need to see if we have a public-private option. We only save about 1/7 of the money that we could save with a single-payer system. And we know with all the money we can save going to single-payer, we can provide more health care. We need to change the conversation and stop talking about health insurance and start talking about creating a system that provides health care.
Finally, Russell Mokhiber, this latest news today of Social Security and Medicare being threatened, going bankrupt, not being solvent. We have just 30 seconds to go.
Well, it's interesting that, you know, the health insurance companies got past so-called Medicare Advantage, where we, the taxpayers, pay the health insurance companies to undermine Medicare. Medicare is single payer. You know, one of the propaganda pieces of the health insurance industry and Max Baucus and President Obama is they want a uniquely American solution to health care, by which they mean not single payer because it's so-called socialist. But it's interesting that the New Republic ran an interview with the guy who created the Taiwanese single payer system. They looked all over the world, and they modeled their single payer system on our Medicare, a uniquely American solution. So this is what we need. We need single payer, Medicare for everyone, single payer, and we're going to get it done with creative civil disobedience. Go to singlepayeraction.org, sign up and donate, and we'll get it done with 1 million active Americans.
Russell Mokhiber, founder of singlepayeraction.org, also editor of the Corporate Crime Reporter, and Dr. Margaret Flowers, speaking to us from Baltimore, Maryland, a pediatrician and co-chair of the Maryland chapter of the Physicians for National Health Program. This is Democracy Now!, democracynow.org, the War and Peace Report. My next guest for the rest of the hour is Howard Zinn, one of the country's most celebrated historians. His classic work, People's History of the United States, changed the way we look at history in America. First published a quarter of a century century ago, the book has sold over 1 million copies and continues to sell more copies each successive year. After serving as a shipyard worker and then an Air Force bombardier in World War II, Howard Zinn went on to become a lifelong dissident and peace activist. He went to college under the GI Bill, received his PhD from Columbia. He was active in the civil rights movement and many of the struggles for social justice over the past half-century. He taught at Spelman College, the historically black college for women in Atlanta, was fired for insubordination for standing up for the women. He is now professor emeritus at Boston University and was recently honored by Spelman. Howard Zinn has received the Thomas Merton Award, the Eugene V. Debs Award, the Upton Sinclair Award, and the Lannan Literary Award.